Thank you for the opportunity to present our recent findings from a systematic review that we have conducted, which looked at the different complementary therapies as a treatment for childhood chronic functional constipation. These are the affiliations that we need to disclose as part of this presentation. Complementary therapies cover a wide range of treatments, and there is no universal definition for the term. In general, complementary therapies are viewed as different treatments that are unconventional and may include treatments such as herbal medicine, massage therapy, and food supplements. Often these treatments are given alongside more conventional treatments. In order to provide up-to-date guidance on the effectiveness of complementary therapies in the treatment of children with chronic functional constipation, we conducted a review to identify studies that reference the use of complementary therapies. Specifically, we wanted to know what types of complementary therapies have been used to treat children, and how effective were they in reporting and alleviating the symptoms. Initially, we conducted a scoping review to identify all of the evidence to support the management of childhood chronic functional constipation. The scoping review identified studies of all designs which mentioned the management strategies for childhood constipation. Participants were aged from birth all the way through to 18 years, and they included children with and without additional support needs. Major electronic databases and archived databases were searched using adapted, established search filters, and all studies found relating to complementary therapies and interventions were then considered in a focused, systematic review. In our focused systematic review, a hierarchical approach was adopted to study selection and inclusion. Firstly, we identified and performed data extraction on and quality appraised any systematic review and meta-analyses. Secondly, we updated any high-quality systematic reviews older than a year. Thirdly, we identified randomized controlled trials and other primary studies that reported on interventions not addressed in a systematic review, and we included these in the synthesis. Study selection, data extraction, and assessment for risk of bias were conducted by 2 independent researchers. Data were extracted from identified studies and were described using the TIDIA framework. For each different type of intervention identified, we provided a summary of evidence and assessed our level of confidence in the findings using the grade criteria. We mapped our evidence to different levels of care provision in which the intervention might be provided. The levels of care provision identified were treatment levels, treatments readily available over the counter that could be delivered by a carer or a parent, treatments that could be delivered as part of a primary care services, treatments that could be delivered as part of secondary care specialist services, and treatments that were delivered as part of a highly specialist consultant-led tertiary service. From the scoping review, 50 papers were identified as being potentially relevant. After we had assessed each against the selection criteria, only 13 studies met the criteria for inclusion. Of these, there were 3 systematic reviews, 3 randomized control trials, 1 non-randomized control trial, and 6 primary studies. 2 of the systematic reviews were classified as high risk of bias, and therefore, in line with our protocol, no further data were extracted from these studies. There was a total of 883 participants, ranging from age 7 months to 19 years, included across the 11 studies. The evidence was divided into 2 categories: the use of manipulation techniques, and the second category, the use of herbal and/or traditional medicines. Manipulation techniques were delivered across primary, secondary, and consultant-led specialist services. For example, abdominal massage was delivered in the community by specialist health visitors who trained parents and carers in massage therapy. Secondary care interventions focused on spinal manipulation, reflexology, acupuncture, and electrical stimulation. and interventions delivered or referred to by consultants or highly specialist services included reflexology, cupping therapy, osteopathic manipulation techniques, and vertebral adjustments. Herbal-based medicines were also identified. These treatments were all administered in the secondary care at paediatric clinics and tailored medical centres. We assessed our confidence in the findings related to 9 different interventions. We found no moderate or high-grade evidence. We had low confidence in evidence for 3 interventions and very low confidence for 5 interventions. Aspects of care where there are some low-grade evidence for the effectiveness of complementary therapies are shown on this slide. There is very low quality evidence that abdominal massage for children with an identified disability may result in equivalent or better outcomes than standard care. When delivered as part of secondary care services, there were low quality evidence that herbal or traditional medicine for children may result in equivalent or improved outcomes. And finally, when delivered as part of secondary care services, there is very low quality evidence that manipulation techniques result in better or comparable outcomes to standard care alone. Evidence on the use of complementary therapies in the treatment of childhood functional constipation is of low quality. At best, we have low confidence in the evidence that does exist. These findings align with the NICE guidelines, which conclude that despite widespread use of complementary therapy, there is a lack of evidence behind their effectiveness to treat any ailment. Recommendations centre around the need for more high-quality studies in this field. In addition, a provision of greater clarity of selection criteria, accepted definitions of constipation in children, and outcome measures are called. We'd like to thank our stakeholder group members for their invaluable study. And thank you for listening.